Hello, everyone. Welcome or welcome back to another session. Today, again, we have your fertility nurses joining us on set. I'm Nurse Joanna Damina, your host, and we have beautiful, intelligent nurses here again, where we have and
I'm Nasrus Ogogo.
okay,
This is my real face.
so this is her real, profession. Apart from when you see her
Not
hosting,
your host today.
exactly, she's not a host today. But we're all just going to have a discussion. Basically, I'm also a nurse, and I'm just here with my colleagues trying to talk to you about some burning questions that you might have asked about fertility, or even something that you may not have asked. You didn't even know that it was something that you should even ask about or even question in your mind. But we'll talk to you about that today. Um, so thank you so much for joining us every time. We do appreciate your likes, your comments, and your shares. On that note, you can share this with someone you think would be interested in the topic, someone that has been dealing with give you more information to help you make informed decisions because those are the best that you can do for yourself. So, guys,
Oh yeah.
I usually don't say guys, these are my colleagues.
Yeah.
Let's just warm it up a little bit. Fertility is a very interesting journey, and we've seen that over and over again. But at what point do you say a couple should actually start on that? Usually we don't really think of having natural conception at home as much part of the fertility. We usually look at other when they start to seek other options. So when would we say is a good time for a couple or a person to actually come and think of wanting to start other options in the fertility journey?
So usually you have a lot of people that most times when people are seeking for fertility,
Mm-hmm.
people expect that they're already of age, they've waited for a long time. You
Yeah.
know, that's the notion. When you tell a young person that the person needs IVF
They're
or the
just
extra,
like,
they're just like, I'm
I'm
young,
young,
I'm just
yes.
20. So but actually um if you're going by gynecological standard, for someone less than 35 years,
Mhm.
if you've had sexual intercourse consecutively for over 1 year,
Mhm.
less than 35, and you've not achieved pregnancy, it means that you should start seeking for help.
Okay.
But if you even know you have a problem and you're less than 35 and they've told you you have blood to for 1 year,
Exactly.
so well, yes, if you feel you're fine and you've tried, you're less than 35, you've tried for over a year and you're not having conception happening, then it means you need to seek attention.
Mhm.
And if you're over five and you feel you're okay, you've checked you're okay, and you've tried and nothing is happening, then yes, you actually need to seek
So
help
since
because you feel you're young, time is
Mhm.
going. I mean,
And we know that we've seen it multiple times. Even if you're joining us, today and you've joined before, we've spoken about how the older you get, chances of fertility actually reduces. So you might want to, that there's something wrong. Come and talk about seeing within this timeline you haven't achieved pregnancy. That's actually also a good time to discuss with your fertility specialist, even your gynecologist. You can start from there, and then they can put you through and refer you more to other people.
or you're a man, they've told you you have maybe no sperm at all. You keep the
Mm,
woman that she's less than five.
exactly. If you don't have yeah. Mm-hmm. Yes.
Yeah.
Mhm.
Yeah.
It's already, yeah,
Exactly.
it's
Yeah.
appreciated. Mhm. Yeah, yeah. Yeah, and then for age as well, by the above your mid-30s, the quality and quantity of eggs actually later. It's way
Yeah.
more rapid. Yes, so you have between that age to, and then all of a sudden you're seeing menopause. That's just a short window of time, as opposed to men. They can go a lot.
Yeah. That's
You
true.
can get a lot older before that to see, problems sperm. But
Well, this is me just thinking.
yeah,
Yes, some of these conditions and some of them could be genetic. So maybe a lady, you've just watched your family trend that is having irregular thing, people are struggling to conceive. I don't think you should.
you'll be
Yeah,
struggling
just
exactly.
just check. I mean, check, watch the trend. Then
Yes.
if you know why not help on time and then just say doing anything about it. I
Exactly.
reject it. My case is
And
different.
before you know it, you're going through that struggle, like you're going
Yeah.
through all those prayers and all of
All
that.
of
Yes,
that.
definitely help. But if you start to make preventative measures, yes, by the time you're an adult, you're thinking of, even if you're not thinking of marriage, let's say you're thinking
Yeah.
of conception or anything related to fertility, you can start checking on this. Some other is apart from infertility, some of the conditions, other medical conditions like diabetes can affect.
Yeah.
So if you know your family is predisposed to a medical condition that can
Hmm.
affect you, by the time you're old enough, you
Yeah.
can just check on those things maybe every couple years, and then you have a total duration of time
And
where you check
even
those out.
sometimes some of these infections that people seem to ignore, untreated
Exactly.
infection, pollen, because you just hear someone say, I've been good all my life. I've not this thing," but then
Yes. But
when
then,
it's now time, it doesn't just
mhm,
sometimes poorly treated infections and all
yeah.
that
See,
and
there's
all
a
of that.
lot
Yes, yeah, a
actually
lot
involves
actually,
in
a
it.
lot.
Yeah.
Yeah.
Mhm. So, like for the conditions you mentioned, like PCOS, fibroids, endometriosis, I know we've spoken about this a lot, but can we just, point out a little bit on how this can affect, how would I say, fertility in general? I know, like for example, we're talking about PCOS, it affects ovulation. Fibroids can also, depending on their location, the size, different things can affect implantation when it comes to that and things like that. So, do we have any more to just top up on these specifics of how these medical conditions can affect fertility?
Okay, so speaking of PCOS, we know that they have a problem with quality of eggs, and
Yeah.
that's why people that have PCOS, you see, miscarriage is not far from them.
Mm,
They sometimes, in fact, you can have it as bad as no period at all. I
exactly.
mean,
Yeah.
because ovulation is the problem, and even when it seems like they haven't seen their period, the quality of the egg is a problem. So that's another thing that can actually affect their fertility because if there's a problem with egg, it means fertility is already tempered
Compromised.
with,
Yeah.
yes.
Yeah.
And then sometimes some of these people that even do there are some people that do pregnancy termination, for instance, and then they do D&C and then they just finish the uterus. That's the word I'll
Yes.
use. Like the
Honestly.
endometrium is just destroyed for life.
Yeah,
Like you just
because
feel
it's
like
such a
pregnancy
rigorous
cannot
method.
exactly
Yeah.
like they just
Yeah.
sometimes you have some of these people come for evolution when eventually it's time that they feel they need children and then going into the evolution you see scars everywhere, you
Exactly.
see adhesions
You see
everywhere
such a
and
thin
all. Even
endometrium
for
and
you
this.
just wonder what can really be done. You just want to
Yeah,
just say
that's like the
let's
house,
try and
and then the
all.
house is in disarray. Yes,
Yes.
there's just so much going on in there.
Exactly. So if the uterus is in such a bad state already, the chance of having pregnancy is really poor.
Yeah.
That's why yes, even miscarriage, even some people that have miscarriage, maybe they didn't even terminate the pregnancy. Sometimes if the way they go about the evacuation is really in a very very poorly managed way, of course, it can also jeopardize their fertility prospects for life.
Yeah.
And that's why, as women, you should be mindful of where you're actually seeking all this attention. You should be very mindful of it. And then, yes, when infections strike and you don't just do self medications,
Exactly. Oh, there's a
please
lot of
seek.
self
Oh
medication.
my
You
goodness.
just you
Oh,
there are some
it's
products that you probably haven't even heard of, and then somebody's come to tell you that
oh
that's
my
what they
goodness.
use.
It's
Exactly.
just people doing a lot of self medication. This one
Yeah.
worked for me, or say, it's my roommate that gave me
This
this.
one, something you
Oh
probably have
goodness.
been using it in secondary
Oh
school. If you've been
goodness.
using something for that long and it keeps coming,
So
you're taking
all
someone else's self medication and then you're putting yourself through that. Every medication has an effect on the body, and definitely if you're treating infections for such a long period of time, that means there's something inherently wrong. You need to find the root cause of that, because otherwise you're just going to keep managing. That's basically what you're doing. Yeah.
and well, this is me just thinking a lot of these people that consume heavy chemicals on their body, all the
Mm.
bleaching. In fact, anywhere you do anything that will just change the color of the skin, you can find it with them. Well, it's aside fertility, they have high chances of coming down with skin cancer and what have
Yes,
you. It
yes.
predisposes them to cancer. It
It's
can also hamper your fertility. So if these two things eventually are at risk, I mean, why would you
why
want to
would you
go
want to
through
do
so
that?
much
I
to
mean,
to
black is really beautiful, but you're destroying the pigments that God gave you naturally.
they'll say now packaging first, but what's inside?
Exactly. What are you packaging to get?
Yes,
What
exactly. Do
you're
you
packaging
understand?
for, you need to be able to feel confident in yourself, and confidence doesn't only come from the outside. Yeah.
That's true.
So, these are some and like you said, long-term fertility, right? I want to talk about contraceptives. There are some contraceptive methods that are used, especially, let me say, the morning after pill. Yeah, I know
Yeah.
that's used very often, especially within like young ladies. And
Yeah.
if you're not using other sorts of contraceptives, how did this affect fertility in the long run?
Contraceptive doesn't really affect fertility,
Mm-hmm.
especially when you do the ones that after birth they put the implant,
Yeah.
IUCD, and all of those things. Women react to it differently.
Mm-hmm.
Some people take a while before they see their periods back,
Yeah.
or they have their normal fertility back.
Mm-hmm.
Or it doesn't really affect fertility completely. Before you hear that, it's because after I did this, I couldn't get pregnant again.
Yeah.
And all of this. No, contraceptive doesn't really work that way for women. I would just say that women um get their own way, like it affects everyone differently.
Mm-hmm.
Yeah.
And oftentimes when people have this contraceptive and it's time to let's say for someone that's even had one child and they want to have, they just say, look, I'm not ready for, and then eventually when they are ready,
Yeah.
they deal with, they try to take off whatever contraceptive they are with or they are on. I would just say age is catching up.
Yes,
Because
exactly.
your previous conception, you were much younger, and
Mhm.
but nobody really knows. There are people that have premature ovarian failure, and
That's
sometimes
true.
you never really can tell when
At
it's
what
going to catch
point
up
is
with
going
you.
to come? Yeah.
So it's just that, yes, everybody's body reacts to things differently. Some people as
Mhm.
they age, quality of egg is also declining. And then as they age too, their body begins to show some of the symptoms. It feels like PCOS that was not really glaring. Then
You
now
now
you will
come
not be
in.
like, but I had this, and you're like, maybe you've always had it. You were just lucky. Maybe then it had not showed symptoms,
Yes, yeah.
but eventually now it's showing symptoms. So I would just say it's more of age catching up. That's why some
Exactly.
people actually have or some conditions that would have maybe developed
Over
after.
time, yeah,
Yes, not necessarily
has to do with the contraceptive.
contraceptions,
And if
because
you're
we know a lot of people that just as they're even taking out the contraceptive, it's just as if
among,
the,
it's
the
like this
pregnancy is waiting.
immediately.
Do you understand? So
Yeah,
it's not necessarily the
everybody's reaction is different, just like Joanna
exactly.
said. Yes, everybody's condition is different, and
Yeah.
if your body can take as much time as it wants to give you.
Yeah.
But then again, if you go a certain period of time, like we mentioned the ages, and if you're trying for a year, if you're trying for 6 months, that's when you should actually be worried, because sometimes contraceptives can be hormonal. Yes,
Exactly.
so
True.
they can actually affect your hormonal balance, and then
True.
afterwards it
True.
takes your body sometimes to recalibrate back to
Yes.
how it
Very
was
true.
before.
Very
So
true.
I don't think you should be worried about it like that. Contraceptives are not affecting your fertility. If fertility is affected after you've had contraceptives, then you should see a specialist about that, because it means there's something behind that. Yes, it could be age, it could be medical conditions that are coming up, anything exacerbating like that. So
Yeah.
it's not
Necessarily the
contraceptives.
contraceptive. Yeah.
Yeah, so let's move on to men out there. I don't know how many of you are here, because almost all the time we get comments from women. But in case you're here, tell all your friends. In case they're not joining, you can still just tell them a little bit of I see
Say
that men
hi.
are,
Let's know you're
yeah,
here.
exactly, say hi. Sometimes men are shy to ask questions around fertility, because especially from our society, it's such how would I call it, a
Egoistic.
exactly, it's so egoistic, and it's like your prowess. Once you're a man, you
Exactly.
are
Like
fertile.
yeah, just
So when they have issues, you see that it's hard to come up. But like we said, it's quite common. You still have men struggling with infertility. Yeah, but some of the things that we have behind male infertility could be low sperm count,
all fingers are pointed at the woman. When will you
Mhm.
give us our own?
Yeah.
If the woman knows it's the husband that's the problem, they
And
will
she
still
still
point the finger
carry
and she still carries that burden. But over time, recently, it has actually shown that
We were kind of moving on to men now, trying to talk about factors that might actually affect fertility. Yeah, fertility is not just a woman's burden to bear. And then we've
yeah,
actually in our society, like alcohol,
Yeah,
smoking,
smoking,
and then you're going through so many, you want to carry everything and you're so stressed,
stressed,
and stress really
exactly.
breaks down your
Yes,
body.
it's
Yes.
yeah. And then even some medications that they used to treat some of these metabolic conditions, hypertension, diabetes, some of them actually
Yes.
affect the quality of
Yeah.
sperm. Even poorly treated infection can also affect the
Also,
quality.
yeah.
It's just like even children, sometimes when they come down with what we call mumps, that could also actually
True,
affect.
yeah.
And sometimes it's not properly taken care of. Yes, it's a
Mhm.
virus, it's not properly taken care of. That could actually affect
Fertility.
the sperm.
Yeah.
And even when you have conditions like varicocele, yeah, you have the veins around the scrotum very much
Very
enlarged,
enlarged,
yes, and then it
yes.
make
So
they are
there's
so
that
dilated. There's
concentration,
this heat that it
exactly.
causes could
Yeah.
actually affect
And that
the
heat thing as well. I know we're talking about it. That thing where you're always putting your laptop on your
oh,
on your laps.
radiations
Yeah,
from
exactly.
it.
And then wearing tight underwear,
Yes, and all
there's
that.
no, I
You
know
can't breathe.
Oh yeah.
you can't breathe. And
Yeah.
so all of that heat just, traps a lot of
To
you
reduce
sit or you stand just
radiation.
to reduce
Yeah.
all of that going on. But does low sperm count mean that a man can never have children?
Not at all.
Yeah.
Not at all.
There are a lot of
If
men that have had low sperm count and still have children.
Mm-hmm.
Yes, but then it doesn't mean it affects, yeah, but it doesn't mean that you totally will not have children.
Yeah.
Sometimes you can have children with like natural conception, and
Mm-hmm.
then sometimes with IVF, either IUI or IVF ICSI,
Okay.
can help to
Yeah.
get through with
Yeah, so
it.
talking about that, like that's another part, another fertility treatment. Apart from, yeah, ICSI and
but,
IUI. So
but at
that's
least for ICSI, the sperm should be to a very large extent be actually good
good
for
quality. Yeah,
ICSI. I
yeah.
mean for
For
IUI,
IUI,
yes,
yes.
IUI for IUI, the sperm should, to a very large
So
extent
for
has to
IUI,
be
it's
good.
okay. Let me just say IUI is intrauterine insemination.
Mm.
ICSI is intracytoplasmic sperm injection. So for IUI, you're not going through that process of IVF per se. It's still a fertility treatment, but
We're
you're
not
going
removing
to,
the
yeah,
eggs
we're not
to do
removing the eggs. The eggs are going to
fertilization
remain
outside.
there. So we're just going to get the sperm and then
Past the barrier of the
gradually pass
vagina.
it through the place it directly into the uterus. So
Exactly. So
sometimes
it can easily
sperm count, if it's low, and then you may have maybe reduced quality, but it's still good enough, and it can still lead to pregnancy or lead to conception. It might struggle with the passage, the normal
maybe the
passage. Yeah,
cervical
the
mucus too
mucus
can
is too,
also
yeah, exactly. And
prevent
then
movement.
the harsh environment of the vagina, just in case there's something like that, it can actually reduce the chances of pregnancy if you're doing it naturally. But if you're going through IUI, you can have the sperm directly
Still,
injected
yeah.
into the
Mm.
uterus, so it has a better chance of going to go and miss the egg, and then they'll
That's
come
true.
back together and
Yes,
fertilize
exactly.
the uterus.
Yeah. Well, so and then ICSI, yes, for speaking of low sperm count, sometimes when the embryologists have checked through the sperm and they've seen
Yeah.
what the quality is like, they can ascertain that it will be better if they inject for a sperm that has a very poor motility. It's not easily able to swim to get to the
Yeah,
egg, or
so
very poor morphology. So sometimes ICSI might just be a
option.
better option.
Yeah.
Yes, where they inject it into the egg and then hope that fertilization.
Will
And it's good to
actually
know that even if they inject, it's not 100% guaranteed
exactly.
that fertilization could.
There's really nothing that is 100% when
Yeah,
you come
true.
to fertility treatments, especially. So like IUI, you're still the sperm is still going to have to swim towards the
To
egg.
get to
Yeah.
the egg.
So
And it's good to know that the tubes must also be
be
patent.
patent.
Yeah.
Yeah.
You can't be having blood tube and asking
Exactly. So that's one of
for
the things we didn't
IUI.
even talk about when
Yeah.
it comes to
Yeah.
the
Can't be
women.
tubes maybe
Blocked
for the
tubes is one
bra.
of the very once you have blocked tubes, natural conception can't take place. Yes. So you might
Maybe
have
preferably
to
spontaneous conception, because
spontaneous.
IVF too
Sorry.
is not oh
Spontaneous
yeah,
conception.
yeah,
Thank you,
yeah.
guys. So spontaneous conception cannot take place, but
Mm.
you can still have other fertility treatments that can help with that. Mostly would be IVF.
IVF,
So
yes.
that's something that you should really consider when it comes to that. But sometimes infertility is not very obvious. you see a couple and you can't really see
Place and say,
what's the
you know, they show
problem.
for face, like they'll
Exactly.
say.
You know they show for face. You see a
Yeah.
healthy young couple and you
Mm.
know they're not getting what they want to get.
Yeah.
And it's one of the things that we said earlier, unexplained infertility.
Mm.
Yes, we've gone so far trying to pinpoint exactly what causes infertility, but
Infertility, yeah.
medicine and science is a very tricky thing. Sometimes you may not be able to actually put a marker to it, but once you come in and you try your very best, you go through all options, I
Yeah.
think you have a better chance at actually achieving
Achieving pregnancy.
pregnancy.
Mm.
But um this one is a little bit, I don't know if you guys have seen your our clients when they come in, how infertility affects the relationship between them, because it's actually a very real thing.
Very, very,
Yes,
very.
sometimes you see our clients come in and you can notice there's a tension in the
feel
air.
Yes, it puts a
Yes.
lot of strain in relationships
Mhm.
between
Yes.
couple.
So that's something that may not be spoken too much because everybody's trying to present a united front. Yeah, but like we spoke about on Wednesday, IVF is already a very emotional journey, and for
That's
you to
true,
even get
yeah.
there, for the you've been struggling with infertility, it's already so emotional. You're so
Exactly.
anxious.
It's a lot.
Somebody might be blamed for one thing or the
True.
other, and
Mhm.
funny enough, if we come into IVF, usually we do check both partners, right?
Yeah.
Just to know exactly
Mhm,
what, so we
mhm.
have a better slate. And you might
Yes.
see a couple that maybe one partner has been blamed for it the whole time.
Yes,
It's
and
you,
then
it's your family, and then you
oh
see it's
goodness,
a
it's
completely
just
different thing.
It's
It's
just
really really difficult to see. But I don't know if you've had a moment with a client where you've gradually noticed that relationship actually rebuild over the course of IVF, especially when it ends in success. Yeah.
Actually, you could just see it in them.
Mm-hmm.
So I think I would say that I have had a discussion with a couple
Mm-hmm.
that have been waiting for a while
Yeah.
and they not conceived. The tension is real.
Mm-hmm.
There's reduced intercourse, like we don't even want to do this again. We have been doing
Exactly.
this. It's not
Exactly.
building
I know
Mm.
that.
Intimacy is not just it for them.
Yeah.
They are not like they don't want to be, especially when you feel like this is the person that is
You're pushing the blame to
yeah,
one
yeah,
person, so
you're
like
pushing
this
it to
one
one
it has
person.
been said
Yeah.
it's you,
It's
so
you. So you just
you are
have to
just the
fix
cause
it.
of the whole problem.
Especially when we have a case or we have cases where it's only the one that is coming to the hospital. I've been the one doing this, I've been the one doing that. I've been trying to drive my husband to come, but he's
He's
not
not
coming.
interested.
Or it's only in rare cases though that I'll say it's only the men that are coming.
You
guys do better.
Yeah, so the truth is that the tension is there.
Mhm.
They come all broken.
Yeah.
Yes, they come all broken. So you can see it when they come. That's why as fertility nurses we have to be there.
Mhm.
Like you have to hold them through. Don't worry, you'll be fine. It's not 100%, but we try our best to make sure that all things are put in place
Place, yeah.
for you to achieve success.
Mhm.
And then when they come to the end of it, they are good, it's positive.
Yeah.
Yes. And then you now see the man following the wife every day.
Yeah.
For you're like, oh, so this man can be so loving.
Honestly, see my wife.
Oh my,
They will do for antenatal
Check
class.
my wife.
Please check my
Check her
wife.
BP. She has been having back pain. So that's how it is. Yes.
Please, she needs to
it
rest.
restores how a successful IVF or how pregnancy restores a lot of home, restores joy, restores this coolness, serene to a lot of homes.
Yeah.
And another way you see another couple that the man is so supportive. In fact, it's like the woman is the fire. The man is just the one
Yes.
pushing the
Just
woman.
down.
Don't
Exactly.
worry. Let's be hopeful. And the woman say, I'm not doing this again. Don't worry.
Yeah.
We'll be fine.
Very
We'll be
true.
okay. Everything will be fine. Well, the bottom line is whoever, regardless of whoever might be, should I say, whoever it is to blame that making you're the cause of it. I think both partners should actually be supportive to one
Each other,
another.
yes.
Oftentimes you see the most of the time, not all the time, but most of the time, women are able to bear when it's the man that actually has the challenge. Sometimes you have the man saying, I'm just, sometimes you can hear a few men saying, I'm just trying to help her.
Yeah.
If not for anything, I would have gone out there.
Mm.
Do you understand? Like, if not, And it's also worse when you hear a man say, "I have children outside," and then maybe both of them come for evaluation. Then
Yeah.
you are seeing that the sperm is terrible.
And you're
You're
like,
now wondering the children that is
how?
claiming. If he's claiming he wants to help his
How
wife,
did you get
how did this sperm?
there? Maybe
So
you need to go and check that
you just
too.
wonder. Even though sometimes it's difficult for them to come to terms with when you're seeing some of these
Exactly,
issues,
yeah.
but I think that both partners should just be
I've
very
actually noticed
supportive.
that it's easier for women to come to terms with the fact that their quality and
Because
quality of
of
Yes,
the
might not
how
be that good.
society makes
has
it.
Exactly.
Yeah,
Like
exactly.
as
you
a
just have
man,
to.
you have
And all
to
that.
you have to be
Yeah,
good.
just
You
be
have to
good.
be the one that is everything
Yeah.
is okay
You know,
with you.
but speaking of this, I remember that when you see some of these men and maybe you've checked and it seems like the wife is okay, and then maybe you just check, and then you now tell the man that maybe the sperm count is almost zero, less than
Mhm.
1 million. You just see the way the man becomes like ice water. You
Yeah.
just be like, so this man can be this calm.
People would
you
know.
know well, maybe it's just the society that has made the man feel like feel yeah that makes them feel like, okay, that's what makes them
A man,
men sort
yeah.
of for
Yeah.
him. And then once it's the woman just feels that whatever it is,
Yeah.
everything goes for her. And
Yeah.
then you hear the man say, let's do, even when the woman is trying to revolt, I want to use my egg, man, please, let's do egg donation. But when it's time for the man to accept the sperm,
Sperm donation is
he's
like,
struggling. He's still saying,
Yeah.
I will bring.
yeah,
Yes,
I
let
will
yeah.
them.
bring. Let me.
Let them-
It's well, I can also understand for the man. Sometimes the woman would carry the pregnancy. She
Mhm.
still has a way of bonding. But
Yeah.
for the man,
It just feels left
having to
out.
feel like, yes, there's really nothing, and I'm just looking at this child. This child
Yeah.
is not, is not mine. And
Yeah.
and some men too can be terrible.
Yeah.
Yeah.
Yeah, and
They
they
use
just
it
be
to
like
slap
use
them
it
on
to
their face.
yeah.
In fact, they just want to
Yeah.
sideline the man. He's my child. He's
It's
not
not
their
yours.
child and all that. So
So
I can relate. I think that all this, we should just have it all balanced,
yeah.
because sometimes it could be extreme for the men, it could be extreme for the women. So
I
let's
mean,
just
it's
have it
all
balanced.
your fears are actually quite valid to you because as much as we want to be a forward-thinking society, we're not quite there yet. So
Yeah.
we still have people that would blame the man for not
Yes.
being the one to be good.
Mm-mm.
You're not even a man.
And
Things
all
like
that.
that.
Yeah.
But I feel like there's more to being a man. It's not just about how you can bring about conception. Your dream is to have this child, and once you hold that child in your hand, there's a lot more you can do.
Exactly.
Supporting a child, building a bond with a child, it's not
Yes,
easy.
it's a lot. It's not.
Once
It's
you
not.
put that in, I feel like that makes you even more of a man than you could ever imagine because
Yes,
you're
that's
actually
true.
building up this
Mm.
family that you have always dreamed of. Um, you want to add something?
Well, yeah, as you just spoke about this, I just remembered last issue I was opportune to communicate with one of the couple that had actually gone in for sperm donation
Hmm.
and all that. And they were asking the man, how was it easy? It was actually surprising that a man would actually own up to the fact that he
He
has his
has,
children from sperm
yeah.
donation. That's really a difficult thing for a man to
Mm-hmm.
do. And the